Hello, I'm Dr. Ramsey Amin, BurbankDentalImplants.com, and wanted to walk through a case. There's always a lot of questions of what makes the decision to do certain types of treatment over the other. This patient, let's walk through. He's about 70 years old, 70, and has lost all of his molars, recently lost some front teeth. You can see there's one that's broken off over here as well. Some of these are loose, but there's a couple of approaches that we can take on these, right? Maybe we can keep the good teeth and try to implant around the bad teeth. This is the upper jaw. You're looking at it straight on, and here's the lower jaw. So let's say on the lower jaw that we say all these teeth are good. Well, then we would just implant these back teeth over here. If we have more good teeth than back teeth, then it makes more sense to hold on to what you have and build back what's lost. When we have a situation like this where there's maybe no molars, no upper front teeth, we've got some loose ones, these are not all good, then perhaps the best plan would be to remove all the upper teeth. So just because you have maybe a full arch replacement of dental implants on one jaw doesn't mean you have to have it on the other arch as well. The lower can be mixture of teeth and implants, while the upper can be full upper or reverse. So I find that a lot of people have this confusion where I got to pull all my teeth. That's certainly not the case. Every treatment plan should be very, very tailored to each patient. You'll find that a lot of these kind of, I call them super centers or mills where everybody just gets all their teeth pulled, good and bad. It's really terrible to see such a thing. So, and a lot of it comes down, to the patient, their age as well. This is certainly not something you want to do on a younger patient to remove all teeth at all costs. You can see this patient's smile is kind of unesthetic. His teeth are crooked as well. So maybe the teeth are good, but they're not in a good position. Doesn't want to go through braces as age 70. We can see the lowers are a bit crooked, but it doesn't bother him, he said. So the plan is going to be to replace the full upper jaw and not to replace the lower. And I'm going to keep walking through this here. So this is a temporary restoration that we're using on the top jaw that he came in with. That's just a piece of plastic. It's called an Essex bridge. And this is the way the patient bites together here. So what we'll want to have a good look at is, the patient's bite, how they come together, whether we're going to maintain that or open their vertical dimension, whether they need more lip support. I find a lot of ladies, they get some wrinkling up in this area, or their face or their new teeth are put back too far. The lower teeth are just going to be cleaned up. But what I want you to note is look at how the back teeth are, how there's a lot of bone missing back over there, just kind of caves in the back. So that's going to have to be corrected with bone grafting. And for me, this is all going to be done simultaneously in a one single visit for this patient in the office under sedation. So the patient's going to sleep through the whole thing. This is their side view over here. This is all part of the process of working up each patient very carefully. And we can see their tongue kind of sticking out over here. I know they're very, very close-up pictures, but that's what it takes. You can see the bone loss in this area. So if we were going to just put implants back over here, if he was okay with the crooked teeth and the decay up in here, then we would build those areas back. Sorry for this is a surgery, went right into surgery here. Let me rewind this for a minute here. So the plan is going to be to do a full upper replacement of teeth. And I'm going to walk through with this patient why regular implants, why I wasn't able to do that on his upper jaw. Part of the plan was going to be to take some of these roots, some of the roots up in here, to grind them up. They're made out of dentin, which is kind of like bone, and use that plus some bone to graft back the bottom teeth. So basically repurposing, recycling the teeth. Take out the upper teeth, grind the good parts of them, put it under the gum to build back the lower at the same time. So the plan is going to be to do full upper and then put 2 implants on the left, 2 implants on the right, clean up all the lower front teeth. I'm going to kind of zoom through these surgeries over here. That's what that looks like. This is the day of the procedure. Here's the lower implants. You can see 1, 2, 3, and there's a fourth one right behind there. Sorry for the blood. These are some dissolvable stitches. The bone is built back, especially on the outer wall over here. And this is the upper jaw on the day of surgery. Sorry for the blood, but it's kind of important that you see these things. These teeth, these stitches will dissolve over time. As the teeth remove, implants placed. In this case, the patient had zygomatic implants placed in here. So you can see what this looks like after it's healed. So where we used to just have a few teeth over here, now we have 6 evenly spread implants everywhere. For some patients, 4 is enough on upper jaws that are very hollow like his, and I'll really show you his x-ray, which is very important. If we can add some special ones called pterygoid implants in the very back, these are these 2 implants in the very, very back over here. That's going to give more support because this patient, hard to believe, but all of this area is hollow on him. Basically, from the nose on back, all hollows, the expanded sinuses, no good bone at all. And that's why I had to use his cheekbones over here to place the implants right into the base of the cheekbone where there's some hard bone right above the sinuses. And then behind that, where the wisdom teeth used to be. So rather than growing the bone back on the upper jaw, I use the good bone that he already has. This is a more advanced technique, but it allows him to get teeth right away. So if you look at the x-ray here, which is interesting, okay, so the lower teeth, we can see I've placed 2 implants on either side, and the molar positions kept all those lower front teeth. But what I want you to take special note of over here is that the upper jaw is completely hollow. So right in here, from here to here, where you see these 2 implants are about right here, everything beyond that is hollow. So you see all this black spot right here, black spot, big, massive black spot here. There's no bone to place regular implants into. So unless I'm going to build this bone back by grafting the sinuses, which is perfectly doable, I've done literally probably 1,000 of those. I'm either going to build back the bone through stages, about a year or so to build that back, or we're going to bypass by placing zygomatics and pterygoids into the good bone. This allows him to have teeth right away without bone grafting and with a high degree of safety and success. It's a procedure I've done for a very, very long, long time. The upper teeth, like I said, were ground up, repurposed, grafted into the bottom, add some cadaver bone to it as well, or the patient's own bone. Usually I use their own bone and their own teeth. That's all ground together in a mix, plus the patient's blood taken from their arm. It's called PRP or PRF. You probably heard about that for people getting hair transplants or other types of maybe knee injections or joints. PRP is called. Also very, very helpful. So this is what the x-ray looks like at the time of surgery. The teeth were delivered the very, very next day. And you can see how things look. Okay, he's in the temporary restoration right now. You can see that I only gave him immediate teeth on the top jaw. The bottom jaw, because they're not all connected from right to left, best to just let those heal. It had bone grafting, so we're going to replace the top teeth right away and allow the bottom 3 or 4 months to heal before making those teeth. I'll walk you through this process. So this is the temporary restorations. He's had them, maybe this picture was taken a month out or so. This is called PMMA, polymethyl methacrylate. It's a milled prosthetic. Beware, many offices print teeth, and some do it better than others. Printing is always very weak versus milling. Milling is done robotically, where the material is kind of carved away, like the Michelangelo started from a block of a stone and was cut back. So these are much stronger restorations. They look better. And we call these the prototypes because they match what the real one is going to look like. Gives the patient opportunity to understand what the final will look like. Yeah, I'm sure you've seen in other videos and blogs that I've posted the difference between bridges that have pink, bridges that don't have pink. There's different reasons for them. FP1 versus FP3. There's certainly a lot of articles I've written on this to where you can differentiate between the two. In this case, he needed a bit of the pink added for durability and lip support, a number of other reasons. You can see the bottom implant healing over here. This is a few weeks out. You can also see the implants heal, the new gum and bone healing in nicely. And the goal is to make all the teeth together all at once. These are the finals, okay? This is a zirconia bridge from end to end. It's got 14 teeth on it. You can see that if I didn't add, you can see where these holes are, right? If I didn't add these back molars on over here, there wouldn't be the full complement of teeth, right? There would be less teeth. In fact, well, we can either do 14 teeth or we could do 12 teeth with larger molars. But here you can see that adding these two extra implants, which is not always doable. Sometimes they cannot be added due to safety concerns, or there's just no bone there, or you can just get one in but not the other. Technically, the most difficult implant to place is called a pterygoid. So without these extra implants, he wouldn't have these extra teeth and not that extra support. And there's no cantilever. The teeth are not hanging at all. It's okay to do that in the lower jaw, a little bit on the upper jaw. We try to avoid it as much as possible in the upper jaw. So this is the lab work, and it's really excellent. This is highly polished zirconia with titanium bases. This is very high-end lab work done right here. There's no spots for the food to get caught into. This is completely convex everywhere. I teach the patient how to use a water pick, how to floss between, how to use little picks to keep this very, very, very clean and really great aesthetics. You can see the surface texture. I'm sorry to be so detailed on this particular one, but people want to see, what real work is like. And this is, I would just say, one of my average cases. Remember that there was only bone in the front over here and no bone here, no bone over here at all. And really, really nice restorations here. These are the bottom teeth. Each are individual custom abutments that are anodized in gold or titanium. This is what they look like on either side. I took off that little part of the 3D printed model so you can see the abutments on one side versus the other. These are held by a screw. You can see where the screws go in, maintaining all of the lower front teeth. Even though they're a little crooked, they were fine. They got cleaned up, gum treated, and everything's healthy. Now he's flossing them. And we can see how this ended up. This is the final bridge in this patient's mouth, and I think it looks great. And it serves many purposes, right? So now he has better aesthetics. He has back teeth to function on. Without back teeth, you cannot have front teeth. Over time, it will catch up with you as you remove molar. So here we can see implanted molars in the bottom over here and upper full arch implants on top. Really neat case. This is what it looks like in the mouth over here. You can see the teeth go all the way to the very back. These are the screw access holes over here. That blue is just where I'm having the patient bite up and down to work out any bite bite discrepancies. Look at the bone all built back over here now. Implants, those 4 implants added back over here. And that's a complete treatment plan. I find that many people don't do complete treatment plans. They'll just do one arch and they'll leave the other just kind of failing along. Um, the whole mouth has to be healthy for this to work out long term. Long term maintenance is very, very important. Coming in on a regular basis, getting x-rays on a regular basis, cleanings, measuring the gums, feeling the gums, the consistency of the gums, things that you can't necessarily see or feel need to be checked on a regular basis. This is the side view over here. You can see the patient's able to keep that real clean. And that's just buttered right up against the gum. There's no gap there. It's just enough to fit a little floss threader through. I have a funny video on me actually trying to do the floss threader on myself on camera. It's quite hilarious, actually. How to clean dental implants, I think it's called. And this is the bite on that side. And you can see this patient's just he's got a great smile. Really nice guy, was very deserving of this here, and just looks great. I think he's very happy. It's not too white. It's a very natural appearance. If you didn't know this guy had implants, you would have no idea, right? I go for all natural layouts. I'm not really into the Hollywood um, super, super white, although sometimes we have to do that. Some patients want that. I'll try to help you make good decisions. Now, this is the final x-ray, and we can see that we can see, again, take note of uh, that there's only bone right here. Everything is hollow going back here. This is all empty, empty, empty back over here, empty over here. This is all the way back to those molar positions. We only start to get a little bit of bone way in the back for these specialized implants, the pterygoid implants. And these are standard length dental implants, maybe 10 to 11.5-ish, about maybe 9 to 11.5-ish. On the lower jaw, they're individual teeth. You can floss between them. We've got a nice, we call it emergence profile on each. Trying to move this mouse around, but it doesn't want to move. There we go. So you can see how you're going to floss between here and down into this area, floss in here. It's normal for implants to floss a bit deeper than the other teeth. We can see the fit of all the parts. We can see that all of these connections are very, very tight. There's no gaps at all between the bridges and the teeth. Everything is just right on, and that's really, really high quality lab work. So I work with an excellent lab. I find that a lot of the cases that I redo, the teeth are just very, very poorly done. They're very cheaply made. They use very cheap commercial labs that just, I hate to say it, but they just churn them out and everybody has the same teeth. They don't have a good fit. They're not using a thing called photogrammetry to take these images. All of this is done without any impressions whatsoever, any molds at all. It's all done with digital scanning. I don't use any molding inside the mouth. It's done under IV sedation. If we kind of go back and just look at the whole patient's scenario over here, from kind of recap everything, the individual teeth in the bottom, the fixed bridge, the temporary restoration that you use for 3 to 4 months, always on a soft diet during that time. You can't eat hard stuff until you're done. And many follow-ups, you got to be compliant to this process over here. And this is what the teeth look like underneath there. And this was some of the surgery stuff that I'll skip through over there. And kind of like where we started, right? Removable teeth. So I hope this is helpful for you. It's my thought process during the entire case process from start to finish. This is typical of how I will do things, and they really have just nice results. I'll try not to show too much blood, at least with patients. I do teach a lot of dentists how to do these procedures. That's a big part of what I do, and try to elevate implant dentistry for all. I find that, like I said, I've just seen a lot of bad stuff, especially over the last 10 years. What should I say, degradation of quality. So really, really be careful with who you see for this process. This is like replacing a body part. This is not just getting new teeth. These are something you're going to have for a long time. Dental implants are not permanent. This has a lifespan. I have an entire blog post dedicated to how long should this last, why implants are not permanent. Everybody has a different prognosis. So have this done the best way you possibly can the first time, the very, very first time, and try not to redo this. Okay. I'm Dr. Ramsey Amin, BurbankDentalImplants.com. I'm in Burbank, California, and I'll talk soon. Okay. Take care.